What is the primary pathophysiological mechanism underlying this patient's condition? An 80-year-old woman, a man, presents to the dermatologist with a 1 month history of tense, fluid-filled blisters on his arms and legs. He reports severe itching and denies any new medications or recent illnesses. A biopsy is performed in direct immunofluorescence reveals linear depositions of IgG and C3 along the basement membrane. What is the primary pathophysiological mechanism underlying this patient's condition? Okay, my initial diagnosis would have immediately been bullous pemphigoid
Okay.
because it's fluid-filled blisters, and it's linear deposition of IgG, and there's no recent infections, no recent medication start, so it's probably not anything with that. And that would be autoimmune, so I would get rid of T cell keratinocytes and melanocytes and anything with that. Yeah. So autoantibodies against cell matrix adhesion or cell to cell adhesion. So it's the big thing with bullous pemphigoid is hemidesmosomes, which is I believe cell to matrix. Because cell to cell, I'm thinking of like yeah. So I would go with cell. I would go with this.
Yeah, perfect. You worked through that beautifully, right? And it's kind of, I think one of the key things that you did really, really well in this question is you had like an understanding of, bullous pemphigoid, right? And then you said, okay, it's hemidesmosomes. And so then you're trying to match an answer choice that fits at the best. Okay. So you're
Mhm.
converting their answer, right? Which doesn't say hemidesmosomes because nowadays, right, people always study the buzzwords, right? And so they're not going to have it hemidesmosomes because everyone knows that now. So they're going to describe what is hemidesmosomes. So that's going to be kind of like you said, the cell to the matrix, the connection, right?
Yeah.
Okay, good. So the basal cells to the basal lamella, right? So